Did you know that surgery after age 70 comes with risks that are rarely discussed, even in the doctor's office? As we age, our bodies respond differently to medical procedures, and what was once routine can become unexpectedly complicated. It's not just about the skill of the surgeon or the success of the operation itself. It's about how your body reacts to anesthesia, how well you bounce back afterward, and whether your recovery sets you up for strength or struggle. If you're in your 70s or 80s, you've probably already noticed that healing isn't as quick as it once was. Sleep feels different, energy takes longer to return, and stress hits a little harder. But here's the part many people don't realize. Your outcome isn't just up to fate. Many older adults come out of surgery feeling stronger, more independent, and even more confident. Not because they got lucky, but because they were prepared. In this video, we're going to walk through 5 essential things every senior should know before having surgery. These aren't just medical tips. They're powerful tools to protect your health, your mindset, and your quality of life. So stay with me because what you do before, during, and after surgery could make all the difference. Let's get started. Number 1. Understanding anesthesia in the aging body. When most people think of surgery, they picture scalpels, stitches, and recovery rooms. But the real turning point often happens before the first incision, the moment anesthesia kicks in. For older adults, anesthesia works differently. A dose that's standard for someone in their 40s can be too strong, last too long, or cause more confusion for someone in their 70s or 80s. This is called postoperative cognitive dysfunction, or POCD. Some people describe it as a mental fog, feeling disoriented, groggy, or even anxious in the hours or days after surgery. It's not uncommon, and it doesn't mean something went wrong. It simply means your brain needs a little extra time to recover. But here's the key: you can prepare for this. Before your procedure, schedule a talk with your anesthesiologist. Ask questions like, what type of anesthesia will be used? Are there lighter options for someone my age? How long is it expected to stay in my system? Can we avoid general anesthesia if possible? There was a gentleman named Robert, age 82, who was scheduled for a hernia repair. Instead of general anesthesia, he and his care team chose a regional block with mild sedation. He was fully awake an hour after surgery, clear-headed, and even reading the newspaper. That one decision made his entire recovery smoother. So remember, anesthesia isn't one size fits all. Ask, prepare, and speak up. Your brain and body will thank you. Number 2. The power of pre-surgery preparation. Most people focus on what happens after surgery. But in reality, the most important part of your recovery often starts weeks before you enter the hospital. Think of it like preparing your house for a storm. The better you prepare, the smoother the recovery. Let's start with nutrition. As we age, we naturally lose muscle mass, which slows healing. But you can give your body a boost by increasing protein in your diet, not just after surgery, but in the 2 to 3 weeks leading up to it. Try adding foods like yogurt, lean meats, tofu, eggs, or protein shakes. It's not about eating more, it's about eating smarter. Sleep is another big one. Deep, restful sleep helps your immune system function better and lowers your risk of infection. In the days before your operation, focus on building a healthy bedtime routine. That means turning off electronics early, avoiding caffeine late in the day, and getting plenty of natural light in the morning. And don't forget about movement. Even light activity like walking around your home, stretching, or doing simple chair exercises can improve circulation and lung strength, which can help prevent complications like pneumonia or blood clots after surgery. There was a woman named Dolores, 79, who was preparing for heart valve surgery. Her doctor gave her a checklist: walk 10 minutes daily, add 2 servings of protein, and practice deep breathing exercises each night. She stuck with it, and her recovery amazed the medical team. She was up and walking on day 2 and went home earlier than expected. Those small steps made a big difference. Number 3. Don't face surgery alone. Build a support circle. One of the most overlooked parts of recovery is who's standing beside you. Whether it's a family member, a neighbor, or even a trained patient advocate, having someone with you during your appointments and recovery isn't just comforting. It's essential. They can help take notes, ask questions you may not think of, and remind you of what the doctor said when things get overwhelming. After surgery, they can monitor for subtle changes in your behavior, help manage your medications, and offer encouragement when you're feeling low. And don't wait until the last minute to line this up. Ask someone early. It doesn't have to be every hour of the day. Just knowing that someone's checking in can be a huge relief. A man named Frank, age 74, had knee replacement surgery. His daughter lived out of state, but they arranged daily video calls during his recovery. He said those short conversations gave him something to look forward to and kept his spirits up. Healing isn't just physical. Emotional support matters. Number 4, don't overlook your emotional readiness. Let's talk about something we don't hear often enough. Surgery can affect your emotions just as much as your body. It's normal to feel nervous before a procedure. But what's less expected is how emotional recovery can be. You might feel frustrated by your temporary limitations, anxious about your future, or even a little down. Some people feel a loss of independence. Others struggle with boredom or sleepless nights. But knowing this ahead of time helps you navigate it with more grace. You can prepare your mind with simple tools. Try gentle meditation or breathing exercises. Listen to calming music or uplifting audiobooks. Set small daily goals like walking a few extra steps or writing in a journal. Talk to someone you trust, whether it's a friend, a counselor, or even your surgeon. You deserve to be heard and supported, not just treated. Remember, your emotional health isn't a side issue. It's part of the healing process. Number 5, plan your comeback before you step into the hospital. Finally, one of the smartest things you can do is plan your recovery ahead of time. Ask yourself, who will help me get home? Is my bedroom easy to access? Do I need a walker or grab bars in the bathroom? Will I have meals ready or someone to cook? Do I need transportation for follow-ups? These aren't just convenience questions, they're safety and sanity questions. Set up your space to be calm and clutter-free. Keep water, snacks, medications, and the TV remote within reach. And talk to your doctor about whether short-term rehab or in-home physical therapy might be useful. When you plan ahead, you give your body the best possible environment to heal, and you take back a sense of control during a time that can otherwise feel uncertain. Surgery in your later years doesn't have to be scary, and it doesn't have to steal your strength. With the right preparation, support, and mindset, it can be a stepping stone to greater mobility, freedom, and confidence. The more you know going in, the better your chances of coming out stronger than ever. If you found this helpful, please like, share, and subscribe. It helps us bring more wisdom to more seniors and support those who deserve nothing less than the best care possible. Until next time, take care of yourself, body, mind, and spirit.